Okay, why don't we go ahead and get started? Good morning, everyone. Welcome to our webinar featuring our latest research on non-traditional hours childcare. Before we dive in and do some quick introductions, I want to take a moment to let folks know that we are recording this webinar and we also have Spanish interpretation available. And I'm going to hand it over to our interpreter to share instructions.
Hello, everyone. Welcome, welcome. I'm going to switch to Spanish right away. Buenos días otra vez. Si a ustedes les gustaría escuchar en español, muy sencillo, por favor vaya a la parte inferior de su pantalla y allí va a ver un globo terráqueo que dice interpretación. Si no lo ve, por favor vaya a un circulito con 3 puntos y allí va a ver la opción de interpretación. Si usted está usando un teléfono, es también muy sencillito. Solamente toque su pantalla y después va a ver los 3 puntos otra vez. Seleccione allí, va a haber un globito que dice interpretación. Dele allí, seleccione Spanish. Una vez que haya seleccionado Spanish, va a ver encima a la derecha la palabra D de dedo O-N-E o finalizar y eso le lleva inmediatamente al canal. Si tiene alguna dificultad, por favor, póngame un mensajito en el chat para yo volverle a poner las instrucciones. Y muchísimas gracias. Thank you, everyone.
Thank you so much, Gabby. We'll go ahead and get started. Welcome, everyone, to today's webinar, which features the latest Illinois Action for Children research on non-traditional hours childcare. My name is Angela Farwig, and I'm the Vice President of Public Policy, Advocacy, and Research here at IAFC. I want to start quickly by just thanking all of you for being here, for showing up, and for continuing our work to uplift children and all who care for them. One of the key ways that Illinois Action for Children advances this effort is through our research, through which we explore the child care system and the experiences of Illinois families and providers. We do this to help drive policy solutions that increase access for families to childcare that meets their unique life situation, needs, and preferences. So that is why I'm very excited to right now introduce my colleague, Alejandra Flores, who's going to present our latest research on non-traditional hours childcare.
Thank you, Angela. Hi, everyone. I'm Alejandra Flores, and I'm the Research and Evaluation Analyst on the research team at Illinois Action for Children. And I was one who conducted the survey and will be presenting today on our findings. So I'll go ahead and share my screen. Can everyone see the screen now? Okay, perfect. Okay, so before I begin, I just want to do a acknowledgement of our partners. Our survey was a part of a 4-year research study known as the Illinois Non-Traditional Hour Childcare Study, and it was a collaboration between Illinois Action for Children, the Erickson Institute Home-Based Childcare Research Initiative, as well as the University of Chicago's Crown Family School of Social Work, Policy, and Practice.
Referral department, how may I help you?
And it is also a policy partnership with our policy partner, the Illinois Department of Human Services. And the project was supported by the Administration for Children and Families. And the study includes several research activities, some of which our partners were able to do. So we wanted to look at the demand, supply, quality, and workforce sustainability of non-traditional hour childcare. And some of the other research activities included a quality framework for non-traditional hour childcare, a scoping review of the supply and demand of this care in the United States, and some upcoming activities include a parent survey and provider case studies. And altogether with our provider survey, these research activities aim to inform IDHS on policy development for increasing high-quality non-traditional hour childcare, which is a top priority for the state and a focus of new state legislation. I'd like to share also a definition of non-traditional hour childcare, which we used in our survey and that providers who participated in our survey were given as well. So non-traditional hour childcare is any care that takes place outside of standard daytime weekday care. So standard care hours are typically 7 a.m. to 5 p.m. And so non-traditional hours is care that is either in the early morning, anytime before 7 a.m., weekday evenings, anytime after 6 p.m., overnight, anytime between midnight and 4 a.m., as well as weekends and irregular schedules such as emergency care, variable hour care, where children's care may vary from day to day or week to week, as well as holiday care. And a bit of a project background. We know that there is a high need for non-traditional hour care and very limited supply of this care. Some previous research shows that about 40% of young children use childcare and early education at non-traditional hours, and families who need this care the most are those who earn lower incomes, who are Black or Hispanic, or who have lower education levels and have jobs that work these non-traditional hour schedules. And we wanted to understand more about this problem for Illinois and for Illinois providers as well. So we conducted a survey of providers in the spring of 2024. And our goal was to understand non-traditional hour care and the unique qualities of care during these hours, the experiences of providers who offer this care, their motivations for offering it, as well as the challenges that they face. We also wanted to hear from providers who don't currently offer this care, so that they only offer care during standard hours, so that we can understand why they are choosing not to offer non-traditional hours, and if there are any conditions that might encourage them to start offering non-traditional hour care in the future. And ultimately, we want to be able to inform policymakers on how they can better support providers who offer this care and increase the supply of it in Illinois. So to begin, I'll share a little bit about who responded to our survey. So again, as I shared, over 434 providers responded to our survey, and this was across 66 counties in Illinois. 37% of those providers were from Cook County. And we heard from almost 3/4 of respondents had at least one non-traditional hour childcare schedule, as in they offered either early morning, evenings, overnight, weekends, and then 1/4 of them offered only care during standard daytime hours. And we had a pretty good mix of providers across racial demographic groups, and also a good mix by provider types. So 40% of respondents were licensed family childcare homes, 35% were unlicensed family, friend, and neighbor providers, and 25% were center directors or owners. We also analyzed provider demographics to identify any statistically significant differences between providers who offer non-traditional hour care and those who offer standard hour care. And we found a few that were statistically significant, and that was that Black providers were more likely to offer non-traditional hours than only standard hours, and providers that were ages 55 to 64 were also more likely to offer this care, and large centers that cared for more than 100 children were also more likely to offer this type of schedule than a standard hour only schedule. We also asked providers which schedules in particular they offered in a select all that apply question, so we could understand which schedules were more offered and which ones were less available. And we found that overall, home-based providers, both family childcare homes and family, friend, and neighbor providers, were much more likely than centers to offer any of the non-traditional hour schedules. As you can see, the purple bars show the centers and how they responded. And about half of centers that offered a non-traditional hour schedule said that they offered early morning care. And then the other half offered standard hour only schedules. And they were much less likely than the FCCs and FFNs to offer evening, overnight, and weekend care. Similarly, FCCs also were most likely to offer early morning care, but a fair amount of them also offered evening and weekend care. And interestingly, FFN providers followed a different pattern, and they were actually more likely to offer evening and weekend care, and also most likely to offer overnight care, which is some of the hardest care to find for families. And a significant proportion of them also were offering weekend care, which can be hard to find as well. When we looked at the reported start and end times of providers as well, we found that the home-based providers and particularly FFNs offered longer hours of care within these schedules. So for example, in early morning care, centers tended to offer just 1 hour of early morning care starting at 6 a.m., whereas FCCs and FFNs started care at 5 a.m., and some FFNs started even earlier than that. So they're offering a much wider range of hours and serving more needs of families here. Another interesting finding was that home-based providers, again, were more likely to offer the irregular care schedules, which were the variable hours, emergency care or drop-in care, and holiday hours when most other businesses might be closed. And also, when we asked providers how much notice they required for this type of care, family, friend, and neighbor providers in particular had much shorter notice requirements for this care, giving families a little bit more flexibility when they did need care on short notice. An interesting thing to note is that the providers that offer non-traditional hour child care tend to do so in addition to standard hour care. So we asked a subset of providers who only offered non-traditional hours whether they were doing that in combination with a standard hour work schedule or if they were only exclusively offering non-traditional hours. And the vast majority are doing non-traditional hours on top of their standard daytime care. And this is important because it really emphasizes how many hours these providers are working. Not only are they working long hours, they also tend to offer multiple non-traditional hour shifts. So they may start early in the morning, offer daytime care, and then also work a little bit of evening hours as well. And we found that on average, the non-traditional hour childcare providers reported working 14 hours per day. And when we looked at the hours that the standard hour care providers worked, they were working an average of 10 hours a day, which is already a 50-hour work week, which is much more than the typical work week. So we really want to emphasize that all providers are very much overworked. And when they're adding non-traditional hours on top of that, they are working much more than a regular full-time employee would be working. Additionally, when we asked providers if they had assistance during these hours, while many childcare centers did have staff on hand during non-traditional hours, as they tend to have many children, they struggled with managing multiple shifts for staff. When they were working for 12-hour plus days, they had to have an early shift and an evening shift, and managing that became a challenge. And then for FCC providers, many of them worked these hours without additional staff, so they had to remain alert for many hours a day and care for children for very long periods of time without any additional help. And again, FFN providers also did not have really any assistance during these hours. We also wanted to ask providers about the unique qualities of non-traditional hour care and understand if care during these hours was different from care during standard hours. And some of the qualities that stood out about this care were that providers were less focused on structured curriculum and learning activities during non-traditional hours, and instead wanted to focus more on free play and creating relaxing and quiet environments for children. So oftentimes, for example, during early morning care, evening care, and overnight care, children were arriving very early, had interrupted sleep, and needed that little bit of time to just rest and relax. And so some children would go back to sleep while other children were offered quiet individual activities or free play while other children slept. Another aspect of the non-traditional hour childcare hours is that providers were more likely to mention incorporating personal care routines and bedtime routines for children. And personal care routines involved bathing children, getting children dressed for the day, feeding them a meal, brushing their teeth, brushing their hair, getting them ready for school. So these are things that weren't always a part of the standard daytime hours, but were very much a big part of the non-traditional hours. They also mentioned creating these calming environments, helping children wind down for bed, and providing emotional support as needed. Another aspect that was unique about the non-traditional hour cares were that families or providers had more trips and outings, and children were sometimes integrated into their family routines. So specifically during weekend care, some providers shared how they would, take children to the museums, to zoos, to outdoor trips and events that weren't always possible during the standard hours when there are more children in care and, again, more of a focus on learning. But during weekends or sometimes evening hours, they could do some of these activities. And integrating the children into their family routines came up a lot for the home-based family childcare homes and FFNs, who said, children joined their family for dinner and joined in on their typical evening routine or their typical weekend routine, and just sort of became a part of the family. Another aspect that providers highlighted about this care was that typically there's fewer children in care overall. And this had some positives and also some challenges. Some providers really enjoyed that they were able to provide individualized attention to children. They felt that they could bond more with them, and they felt that they enjoyed these hours. It was like a preference of theirs. It was calmer, it was quieter, and they liked all those things about it. For centers, they mentioned that having fewer children meant that they had to mix age groups, and it was harder to manage the staffing and have the proper staff on hand for the different age groups. And it could also just be a challenge where there was just fewer children for the children to play with. And so they had to come up with creative activities to involve children across age groups. And then one other thing they mentioned was that there was more school-age children typically during these hours. And some providers mentioned they would offer homework support or tutoring specifically during evening care. Some providers were dropping children off at school or at the bus stop in the morning. And again, they were caring for older children overall. One important finding about the personal care routines in particular was that FFN providers seem to have a different pattern than the FCCs and centers. So FFNs were much more likely to offer these personal care routines. So they were more likely to take a child a bath during evening care, for example. 58% of FFNs said that they did so, compared to only 8% of centers and 11% of FCCs. And this was the case across all of the other schedules as well. And when we looked at this, we were able to compare whether FFNs who were related to the child in care were more likely to do this than those who were not related. And that was the case for some of these as well. So FFNs had this additional sort of aspect to non-traditional hour care that not all providers were doing at the same levels. So we also wanted to ask these providers who were offering non-traditional hour care why it was that they offered this care. What was it that the reason they did so? And this was a select all that apply question here, so they could select more than one. But overwhelmingly, the majority of providers said that they offer this care because families needed care during these hours. About a quarter of them said that they offered these hours to increase their income, and only 13% said that they liked or preferred these hours. In a separate question, we asked an open-ended question about what do they like about offering this care. And the biggest theme that came out of that was that they enjoyed helping families in need and accommodating families' work schedules. One provider shared, "I'm able to provide care for working families that cannot find care in most locations at the times they need." And across these responses, providers really recognized that, parents needed this care, and that without this care, they may not be able to make it to work on time, or they may not be able to keep the job that they have. So really, they were adjusting their care schedule to meet the need of parents, and they were happy to do that, and they felt a lot of sense of pride and joy that they were able to do that. Another big theme was that providers just liked providing a safe environment for children. One provider shared, "I know it's hard to find childcare for evenings and weekends. I prefer that parents have a safe learning environment for them than to try to leave them at home by themselves." So again, providers felt a sense of duty to care for the children who needed a place to stay. And again, we're very aware that there was not a lot of care options for children during these hours. And we're doing this to be of service of the families that needed the care. And then the last major theme that came out was that providers enjoyed caring for children and providing that individualized care during non-traditional hours. So many providers simply said, like, they love caring for children, they love what they do, they like the extra bonding time that comes from non-traditional hours and being able to help them get ready for school or wind down for the day. They like being there for the children. For the relative FFNs, they really liked spending time with the child in their care, and it's somebody who they're related to, that's their family. So overall, they were doing this to serve the families that who they work for. But despite the motivations for offering this care, they also faced a lot of challenges. When they were asked again an open-ended question, the top thing that they shared was that they face very long work hours and inconsistent schedules. So several providers described challenges with having to wake up very early, difficulty staying alert for so many hours when offering care day and night, trouble getting enough sleep, and overall exhaustion and burnout from working very long hours. One provider shared that it makes for very long days for insufficient pay. Another theme was that providers felt that they had no time for their own selves and their own families. They shared it was challenging to find time to run their personal errands, to go to their appointments, find time for their self-care, and even just to spend time with their own children who ended up missing out on time with their parent because they were always offering childcare. And they also missed out on family events and gatherings. Some even mentioned that they struggle to find time to plan activities for the next week or the next day because they're just sort of working around the clock, always offering childcare. For centers, a big challenge was difficulty finding and retaining staff. Centers described challenges finding reliable staff that would work these hours, especially during evenings and weekends, and also the challenges of managing staff schedules when there were such long shifts. They sometimes had to pay staff overtime or have 2 different shifts of workers. One center provider shared that the hardest part is staffing. We open at 5:15 a.m. and close at 5:30 p.m. So adequately staffing classrooms for 12 hours a day is challenging. Another challenge was lack of parent communication and punctuality. Some parents failed to communicate when they would be needing care, so they may have requested early morning care, but then never showed up for those hours, or they would fail to pick up the child at the scheduled time, and so providers are working longer than they would have liked to or would have expected to. And so they really would like more notice, from parents when they do need or don't need this care, and that would help them a little bit more. And then the last thing was that non-traditional hour schedules are also difficult for the children in care. Providers describe that the children spend long days away from their parents, often have interrupted sleep and inconsistent sleep schedules. And additionally, one center provider shared how during weekend care, there's different staff that work weekends than those that work weekdays. And that could be a challenge for children when the person that they normally see at childcare is different. And so it's out of the norm for the child, and they may struggle with that. And it might be more difficult to provide care for the children when they're emotional. And just being away from their parents for a long time is hard. Another challenge that providers share was that some licensing rules, which are designed for standard hour care, could be more challenging during non-traditional hours. And this was the case for about 25% of FCCs and 11% of centers. So it wasn't a very big amount of providers, but these were some of the things that they mentioned were challenging. One was the restrictions on the number of hours that they can care for children. So providers shared that they often have to amend their license to meet the requirements for clients with non-traditional hours. And so having to do that every time they have a parent requesting this care was difficult for them. Additionally, staff-to-child ratios are more difficult when caring for fewer children across many age groups during non-traditional hours. So one center provider described that the requirement of having more than one staff on hand is silly when I only have 2 or 3 children for the first hour. Having to pay multiple staff to watch them is a strain on payroll. And again, this is a regulation that is helpful during standard hours because we want to make sure that we have enough staff for children across age groups, but during non-traditional hours, when there's much fewer children, it can be more challenging. And then some providers also shared difficulties with completing required annual trainings. As they themselves are non-traditional hour workers, it was hard for them to find the time to complete these requirements and needed more flexibility to do so. Providers were also asked if offering non-traditional hour care increased their expenses. And 45% agreed or strongly agreed that yes, offering this care does increase their expenses. And when we asked them what were their top expenses, it varied a bit by provider type. So for centers, again, since they are much more likely to have staff working these hours, hiring additional staff and increased administration time to manage the scheduling of children and staff were their top expenses. And for home-based providers, food for additional meals and snacks and equipment such as linens, beds, and toys were much more likely to be selected by them. But across providers, they also had increased utility fees, and some of them did pay an assistant to help them during these hours. So they mentioned that was an expense. When asked about what training or supports would help providers in offering non-traditional hours, some providers shared that they would really like more creative activities and training that's specifically tailored to non-traditional hours. Only about 20% of providers said that they had completed any training specific to non-traditional hours, but they said they didn't really know of any others available or one that applied specifically to this. So some of the things they really would like to see were creative activities and games that they can do with children during non-traditional hours, and specifically with mixed age groups and school-age children, which are more common during these hours. And they also wanted optional trainings and resources around non-traditional hour care routines, specifically children's hygiene and safe sleep practices, since many of these providers are caring for children who are sleeping in their home or in their center, and also they're incorporating all these personal care routines. So I think they wanted more training specific to that. Another support that they mentioned was increased funding so that they can increase their wages, attract and retain staff, and cover their expenses. Again, staffing was a huge challenge for centers and for providers who were FCCs and FFNs. The low wages weren't worthwhile for the additional hours they were being asked to work. One FCC provider highlighted that a more competitive rate is needed. Generally, pay for school-age children is very low. If they need care from 5 a.m. to 8:30 a.m., you start work at 4 a.m. for $20 a day, in addition to the rest of the hours. So that is just too low. Additionally, providers share that they would like resources and strategies that will help them be successful in offering non-traditional hour care. They mentioned that additional resources around how to navigate their business as a non-traditional hour provider, including strategies for finding families who need this care, how to adjust their fees for non-traditional hours, and how to transition into a second shift would all be helpful, as well as like business acumen, how to handle relationships with parents, would all really benefit them. And then lastly, some providers highlighted that they didn't really feel that they needed additional training. They felt that the training that they already receive to be like a standard licensed provider is sufficient and enough, or they felt that they had enough experience already caring for children, and that was relevant no matter what time of day it was. And I think it's important to emphasize that any training or resources that are offered to providers should be a resource and an optional thing that is going to help them and not just burden them with more required tasks that they need to find time to do. So aside from all of the questions we asked for the providers that already offered non-traditional hours, we also asked questions to the subset of providers who only offered standard hour care. And so we asked them why they chose not to offer non-traditional hours. And for centers, overwhelmingly, they shared that staffing challenges were the reason that they were not able to offer non-traditional hours. They couldn't find the staff and could barely staff the hours that they already had. Additionally, for FCCs and FFNs, their top reason was lack of time and that they already work too many hours. They already felt like they were working full-time schedules and above a full-time schedule, and adding any more time was impossible. Offering this care, many providers felt that offering this care would also increase their stress. And this was less so the case for FFNs, but across the board, providers did share that this was a reason. And then insufficient demand was a reason stated by providers as well. With non-traditional hours, some providers said that they had offered it at one point and people had shown interest or said that they needed the care, but then they didn't actually have the demand for it and they had to stop offering the hours. There's also a fluctuating demand with non-traditional hours, where a parent that may work non-traditional hours may change their job or change their hours and no longer need that. So there's not always a constant need for the non-traditional hour care. And in addition, it wasn't always profitable or sustainable or worthwhile for providers to offer it due to the low pay of childcare providers in general. And offering more hours of care wasn't really making them more money. And then they also were asked what would motivate them to offer non-traditional hour childcare in the future. And for the FCCs and FFNs, the top reason was higher pay. Whereas for center directors, the top reason was staff willing to work these hours. But all providers also shared that increased demand would motivate them to offer it. But a subset, about 1/3 of those providers, said that nothing would motivate them to offer it. It wasn't possible or feasible for them to do so. These providers, again, that offered only standard hours, were asked if they had any interest in offering non-traditional hour childcare in the future and which schedules they had any interest in. And overall, centers were less likely than the FCCs and FFNs to express interest in these hours. The majority did say early morning care. 22% said early morning care would be the one that they'd be most interested in, and 17% said weekend care. For FCCs, 41% were interested in potentially offering early morning care, and 22% had some interest in overnight care. Whereas for FFNs, they were actually more likely than FCCs and FFNs to express interest across all of these schedules. So early morning, half of FFNs said they were interested. 40% were interested in evening and weekend care, and 30% were interested in overnight care. So overall, it seems that FFNs had the highest interest in offering this. So lastly, to wrap up, I want to discuss what type of policy changes might support providers and help increase the supply of this type of care. And our findings highlighted that fairly compensating the non-traditional hour workforce is, number one, the most important thing to increase the supply of this care. Providers report that non-traditional hour care is not worthwhile because of low and fluctuating demand, low pay overall for childcare, and they also incur additional costs and stress when offering this care. And they're giving up a lot of their personal time to do this. And so paying providers a premium for these hours, possibly through CCAP add-ons, for example, could incentivize providers to offer it while allowing them to work fewer hours overall and make this a little bit more sustainable for them. In addition, increasing compensation for childcare staff in licensed programs is another lever to help centers potentially offer this type of care, or to allow FCCs to hire an assistant to help them with these additional hours if they were interested in offering it. Another way to support providers and increase the supply is to support the FFN providers who are playing a very important role in the non-traditional hour workspace. So they're one of the providers who offer the most difficult to find care, which is overnight and weekend care. And they're also offering more hours of care within these schedules and offering the most flexibility to family in terms of notice required for this type of care. And they also seem to express more interest in offering it for those that don't currently offer it. So one of the things that have unintentionally impacted the FFN's participation in childcare is that some federal requirements have made it more difficult for them to participate, and also made it more difficult for them to access subsidies. So adjusting some of those federal requirements could allow more FFNs to participate. Additionally, FFN providers have some of the lowest CCAP reimbursement rates and are paid significantly less through CCAP despite offering some of the most vital services for families. So they're also less likely to be offering non-traditional hour care as a business, but do so more as a sense of duty or community. And so in order to properly compensate these providers, we should increase their reimbursement rates as well. Additionally, we should minimize barriers that non-traditional hour providers have shared with us. So one of those is that they are struggling with the demand side of this and finding the parents who need this care to make it worthwhile. So we can enhance the referral process at the state's CCR and our agencies to help providers find the parents who need this care and help parents find providers who are willing to offer this care. And additionally, minimize any of the licensing challenges that are unintentionally burdensome during these hours as well. And then lastly, offering optional training and resources for the providers that are currently offering this care, offering the creative activities and trainings that are tailored to non-traditional hour schedules, so that they have a bit more support and resources that they can lean on when they are offering this care, but doing so in a way that is optional and accessible to them and not an additional burden. So overall, the top 4 things that we can consider doing are to fairly compensate our non-traditional hour workforce, strengthen our supports for the FFN providers who are playing an important role in this work, minimizing barriers, such as enhancing the referral process and minimizing challenges with licensing rules, and to offer optional training and resources to support these providers. That is the end of the presentation, and I'd like to open this time up for anyone that has questions about the presentation. Yeah, I see someone has their hand raised. Brenda, do you want to share something?
My question is there an actual demand for the non-traditional, or depends on where you are? Because this was actually something that I was considering, but I'm not sure if it's something I want to venture into.
So we do know that there is a demand for this care. There are definitely families that are looking for providers who are willing to offer these hours. But I think it's hard for those families and that are looking for the care and for the providers that are willing to offer the care to find each other. There's not currently a very seamless process for that. So I think it depends on where a provider is located and where the families looking for that care are.
Is there a specific list in the CCR&R for non-traditional providers?
So when we spoke to the referral team here at Illinois Action for Children, they shared that they collect data from providers, but it's not the highest quality data in the sense that they're asking providers like what time are they like able to care for children, and it's unclear if the times that they are recording are their licensed hours, so the times that they are licensed by the state to care for children, or if it's the times that they are actually willing to care for children or currently caring for children. So there's sort of this question mark about what do these times that we have in our system reflect? And when we have a list of providers that maybe are licensed for evening care and we share that with the families, are those providers actually willing and able to offer those hours? And so it's hard then for the families to find a provider that offers those hours. So what we're recommending is a deeper investigation into that data, and also how can we keep better track of that start and end times and willingness of providers to offer that. Like, what other measures can we track so that providers can clearly share and promote themselves as a non-traditional hour childcare provider, and the families will be able to find them when they're looking for them.
Hi, can you hear me?
Thank you.
Yes, I can.
All right, I am a parent consultant for the Resource and Referral Department. So to answer the question, yes, we are the information of the provider information that is in our database. All of the information is mirrored from their actual DCFS license. So whatever that is a requirement. So whatever information that is on that provider's license is what we are to have in our database. So for instance, if a provider states on their license that they are only caring for children between 6 a.m. and 6 p.m., that is the information that we are to mirror in our database. So it's never an issue of if the department is entering information based on the care that they want to provide, it's based on what DCFS licensed them for. And then if they want to proceed in changing their schedule, then they have to go through DCFS. But until then, once with us generating these referral lists to the families that are requesting childcare, all of the information that generates on our list is specifically what is on their DCFS license. So as an example, if a parent calls us and says, hey, we need care that begins from 6 a.m. until 6 p.m., and we generate it according to the time frame, the age of the child, the birth date. The birth date is important because many providers structure their classrooms according to the age, the exact year and month of the child. That is how we generate our list. I just want to make that clear. We're not just entering information just to be entering it. We are entering the information specifically from DCFS. Thank you.
Thank you. That's very helpful.
Yeah, thank you for answering that question very thoroughly.
Hi, my name is Aitadel Shalabi, co-founder and executive director of Arab American Family Services. And what I'm seeing is a growth of Arab American women going into the workforce who need childcare, but want to put them in agencies that reflect their community members, if that makes sense. And I also have a lot of Arab women who need to work and would be willing to do childcare in their homes. Is there an opportunity where would I start helping our community members become licensed? And where would we be able to advertise for these things? I'd like to just maybe start back at zero if you can direct me, just helping a lot of our women become licensed, especially if we can do it in Arabic, because English is not, we kind of forget that there's an Arab American community because we're labeled white. And actually, the state of Illinois, we just passed a bill that recognizes Arab Americans in their own category. But there is a growing need for licensed daycare centers and women who need to put their children non-traditional hours as well.
Does anyone at Illinois Action for Children that's on the call know of where we could connect interested providers?
Yeah, hi everybody. I'm Chris with Illinois Action for Children. And I think maybe we can just like do something. I can connect you with some folks. I will put my email address right here in the chat if you want to reach out. Oh, I see yours. I'll email you. Perfect. Then we're good.
You also, oh, sorry.
Oh, sorry. Go ahead, Alejandra.
I was going to say that brings up a really important measure, which we didn't really talk about in this presentation, but in some of the other research studies, we talk about like culturally responsive like environments and whether that is a very important measure, particularly in non-traditional hours. And I will share my screen later and share those other additional reports that go deeper into that type of stuff, because I think that was another important aspect of non-traditional hours is, you know, and maybe a big reason why FFN providers offer a very important role in non-traditional hours is because they can provide that culturally responsive care, like speak the language of either the parent and provider speak the same language, and why that is an important, another important reason to support the FFN providers in this workspace.
All right, Alejandra, we have another question in the chat from Veronica. Is there working/specific profession who we can offer this to?
There are definitely some jobs that are more non-traditional, that work more non-traditional hours, like retail, hospital workers, even with like tradespeople as well. These are all typically non-traditional hour sectors. How we can create a system that connects those types of employees to the providers is, I think, the missing piece. I think that those exist, and there have been efforts to even create like childcare on site at some of these locations, and that hasn't always been successful. And I think it goes back to like the parent having the choice of finding the provider that works for them and not just being given one option through their employer or at their employer site. So I think that more work needs to be done in order to find the providers and connect the providers and the families.
Hey Alejandra, this is Michael. Do you mind if I chime in real quick on some
Yes,
of the other areas? So yeah, everything Alejandra said was accurate. I just want to add that a lot of first responders as well are looking for non-traditional hour care. 3 years ago, a state rep took a ride along with a police officer, and her main concern was that she had difficulty finding childcare for her newborn because obviously she works a night shift, and she found that, or she also shared that it's not just her, it's a lot of her colleagues as well, both at the police department, fire department, and hospitals and whatnot. So they were able to, or the state was able to pass a appropriations bill around $2 million, which is not really enough to obviously tackle this issue, but a little bit of a start to get some recognition and some money out the door for non-traditional care. So I think we're continuing to work with that at the state level to make sure that this is a need, and I think we know that a lot of folks keep coming back to these state legislators asking where they can find childcare that's non-traditional. So I mean, this is just a recommendation. I don't know, maybe connecting with your police department, fire department, and local first responders to see what the need is at the community level, and then maybe you can kind of do some outreach that way. Because I think the other main thing is like a lot of them don't know who offers non-traditional care too. So it's kind of like a double-edged sword in a way. Like they don't know how to programs who offer it can't get people because they don't know who they are, and then the people who need it don't know where they are. So it's kind of a interesting thing that we might need to figure out down the line. But yeah, I think that's the suggestion that I will provide. And yeah, so we'll continue to see where we go with any specific appropriations or any legislation involving non-traditional hour care.
Michael, I just have a question. I just wanted to add a piece to that. Is there any way that Illinois Action for Children has a database? I know they do because I'm in it. But is there any way that they can create or start thinking about the non-traditional providers and having a specific database just for them?
Can I can I punt that to one of my colleagues at Illinois Extracurricular because I don't think that is my wheelhouse.
No, this is Latrice again, a paraconsultant for the Resource and Referral Department. No, that is not um, a way that our database is structured. It cannot be structured in that manner because we're not only using the database, we're also using a program that is independent for generating this listing. So the way that our program is set up is that if a provider says that they need that they need evening care, let's say from 3 p.m. until 10 p.m., we are able to customize that list accordingly by entering that time frame, and then that will circulate once we enter their information, that time frame that that parent needs. Then that would mean that it will log and it will sort through the entire database for all of the providers that are licensed for that particular time frame that they're seeking. So creating a separate database, no, it's one database, all information per DCFS license from their licenses, and then it's customized according to their specific time frame. And then if they want evening care, our system will sort through the database in its entirety for the number of providers that are licensed. Again, I have to be clear, that are licensed for evening care for that time frame in the zip code that they are requesting.
So it does support them. So because we can give that information that they're open at
Absolutely.
that time. Yeah, so it does support
Absolutely.
them.
Yes,
Yeah.
absolutely. So so we customize it, let's say if they want a center only, but offers night care or evening care. So then we select centers, enter the time frame, the evening hours that they need. Once we enter that information, then it will sort through the entire database in that particular area that they want. And then it will generate that listing of providers of centers that offer that care within that time frame. What we also inform our families as well is this is based upon their DCFS license, but providers have the option to change their mind. So even though in our database that we have to enter what is exactly mirroring from their DCFS license, there are providers that said at the time of licensing, I want to offer evening care, but now I've changed my mind. So we always inform the families to say, we understand this is the list of providers that are licensed for evening care. However, we do suggest to have a conversation with the providers that you're interested in if they will be able to accommodate the time frame and days that you need care. So that way we are covered in regards to, yes, we're doing our job by generating the listing based on what is on their DCFS license, but at the same time giving them the reality that there are some providers that may change their mind. So that is how we garner our conversations with the families that we serve. If that's a help for everyone.
I also see Yvette has her hand up. Did you have something to ask?
Yes, I'm currently, in fact, this week, talking with my licensing rep about my overnight. I want to do overnight only childcare, and there's a lot of questions that she didn't even understand. About the procedure for overnight childcare, the sleeping arrangements. So of course, the cost that we have for like doing the daytime hours, you don't want to have those for overnight hours. So we're going back and forth about what type of portable bedding we can use for the children. So I would like more clarity on like what some of the standards that we have to, that's not in our regular child care standing standards for overnight childcare. So those questions came up, and also the hours that I would need for overnight childcare, because some hours for overnight workers are 12 to 12. They work 12 hours. So they have to have those 12 hours plus time to get to work and come back from work, would put you over that 12-hour limit for caring for children. So, and I would like to have like extended hours, say, for instance, say a nurse cannot get off in time to get the children. So I need clarity, and she wants this week on, what would be the hours I would want and what type of bedding I would have for the children that will be at my home overnight if I choose to do this. And this, I did traditional childcare for over 30 years. Now I'm just looking to do overnight childcare, and I just need more clarity because that's not in our standards.
Is anyone on the call able to talk about the standards for non-traditional hours? I think this is a perfect example of like what came up in our survey as well, where providers need more like information and knowledge about what is different about these hours, and how there are providers that are willing to offer these hours that are struggling to, be able to offer them to the families that need it, due to that lack of awareness about care during these hours.
Are these the hours from after 12 a.m.? Because I do hours from 3 to 12. And I'm trying to see, are you talking about after 12, like in the wee hours, like 1 o'clock in the morning, all the way up to 5 and 6 and 7?
Yes,
Are you talking about those hours?
I'm looking for demographics like, the nurses that have overnight works that have that 11 to 7 shift, 11 at night to 7 in the morning, or night. Some of them have 8-hour shifts. Some have 12 o'clock with that 11 a.m., 11 p.m. to 7 a.m. shift.
So you
So
basically saying like
that'd be
24
complete
hours?
overnight. Pardon me, no. My license would not.
The
I would
afternoon
not be doing
hours till the
daytime.
next.
I would not. It would be evening. I would not be doing daytime hours. So my hours wouldn't start till the evening time.
Like 3?
No, like after 6.
Yvette, thank you so much for posing your question, and I will see if we can have someone follow up with you offline. We are past our webinar time.
Okay.
But I do want to thank everybody for joining us today. I did drop my contact into the chat, as well as the links to our non-traditional hour childcare reports, as well as the childcare study, which is all of the other research activities that have been conducted. And we do thank all of the providers who shared their responses and participated in the survey, and for those of you that shared your experiences now, which I think, again, is really highlighting the issues of the non-traditional hour childcare workforce and the improvements that need to be made in order to support providers offering this care and families who need this care.